Hello, everybody. I'm so glad you made it here today. Keeping our brain sharp is so very important. As we age, the brain naturally changes, affecting memory, learning, and other cognitive functions. Slow cognitive decline is often expected as we get a little bit older, but we can slow that process. And what's not considered a normal or expected part of aging is dementia, a disease signaled by a more rapid decline in cognitive abilities. And we don't have to decline in a way that stops our ability to communicate and take care of ourselves and thrive. This is highly determined by your lifestyle starting right now. Many older adults worry about big causes like Alzheimer's without realizing that, in fact, many cognitive issues signal more general health problems, an alarm going off signaling us of thyroid issues, dehydration, or lifestyle issues that can be reversed. Low thyroid functioning can be experienced as ongoing fatigue and slowed thinking. Too much alcohol can impair memory and cause dehydration, which often simply not drinking enough water throughout the day causes too little blood flow to the brain. Getting to the bottom of what's affecting your ability to reason, remember, or articulate your thoughts is important. So, a memory and cognitive screening should be part of your normal annual wellness visit. You might find out that your cognitive issues are caused by one of a few factors and can often be reversed. Many people add a variety of medications to their daily intake as they age, along with risks of adverse health effects from both individual drugs and then the overall mix of them together. One of the most common drug side effects is cognitive impairment. When older adults mention memory problems, the very first thing that we do is look at medications that they're taking. Some over-the-counter medications, such as Benadryl, which can create confusion, can be purchased under other brand names, and consumers don't actually recognize it, or it's hidden in a combination of products like Advil PM, medications for overactive bladder or incontinence, and those for depression or even sleep can, in just various contributions, also cause cognitive impairment. So combining any opioids as well can make people more confused. Unfortunately, older adults and even many younger adults take a cocktail of medications, both over the counter and prescription. And then that causes major changes in the cognitive abilities. And a lot of times it's a slow process. You don't recognize it right away. It isn't like you take a medication and then all of a sudden you notice it. Sometimes it's the combination, and over time it starts the impairment. So here are 5 things that you can do to protect your brain against cognitive decline. In doing these things consistently, you may also need less medications, which will help even more. So number 1 is exercise regularly. The first thing I tell my patients is to keep exercising. Exercise has so many known benefits, and regular physical activity benefits the brain. Multiple research studies show that people who are physically active are less likely to experience a decline in their mental function and have a lower risk of developing Alzheimer's disease. We believe these benefits are a result of increased blood flow to the brain during the exercise. It also tends to counter some of the natural reduction in brain connections that occur during aging, in effect, reversing some of the problems. So aim to exercise several times a week for 30 to 60 minutes. You can walk, you can swim, you can play tennis, any kind of moderate aerobic activity that increases your heart rate. Number 2, get plenty of sleep. Sleep plays an important role in your brain health. There are some studies that have investigated how sleep actually helps to clear abnormal proteins in your brain and consolidates memories. It organizes it, which boosts our overall memory and brain health. It is important that you try to get 7 to 8 consecutive hours of sleep per night, not fragmented sleep of like 2 or 3 hour increments. Consecutive sleep gives your brain the time to consolidate and store your memories effectively. Sleep apnea is harmful to your brain's health and may be the reason why you might struggle to get consecutive hours of sleep. So, talk with your healthcare provider if you or your family member if they suspect at all that you may have sleep apnea. That is something that can be reversed. We help a lot of people with that. And then get some sleep. Number 3, eat a Mediterranean type diet. Your diet plays a large role in your brain health. I recommend most of my patients consider following a Mediterranean type diet, which emphasizes plant-based foods, whole grains, fish, and healthy fats with lots and lots and lots of fruits and vegetables. It incorporates much less salt than a typical American diet and limit processed foods. Studies show people who closely follow that type of diet are less likely to have Alzheimer's disease than people who don't. We also know that omega fatty acids found in extra virgin olive oil and other healthy fats are vital for your cells to function correctly, and it appears to decrease your risk of coronary artery disease and increase mental focus and slow cognitive decline in older adults. Number 4 is stay mentally active. Your brain is similar to a muscle. You need to use it or lose it. There are many things that you can do to keep your brain in shape, such as doing crossword puzzles, Sudoku, reading, playing cards, putting together jigsaw puzzles, all kinds of fun things like that. Consider it cross-training for your brain. So if you incorporate different activities, you'll increase the effectiveness because they each work a different part of the brain. Number 5, remain socially involved. Social interaction helps ward off depression and stress, both of which can contribute to memory loss. Look for opportunities to connect with loved ones, friends, and others, especially if you live alone. There is research that links solitary confinement to brain atrophy. So remaining socially active may help to have the opposite effect and strengthen the health of your brain. So, exercise regularly, get plenty of sleep, eat a healthy, vegetable and fruit-filled diet, stay mentally active and socially involved. And until next time, have a beautiful and healthy day.